We opened the center officially in the fall of 2015, and we had been treating patients for the past 4 years prior to that, building up the systems and training the staff so that we're fully prepared to treat patients when we open. So we opened the center to be able to help patients who have temporomandibular dysfunctions or TMDs, head and neck pain. There's a big need for such a center in this area, as we found out from a lot of the medical doctors who don't know what to do with those patients. There's just a few specialists in town who treat those problems, and there was a need for another one. We can help patients who suffer from head and neck pain, people with headaches, refer pain to the ear, temporomandibular jaw joint problems, whether patients are hurting because they cannot chew their food properly, whether their jaw locks open or closed. And also, a lot of people who have TMJ problems also have sleep problems. They don't sleep well at night because most likely they're suffocating during the night. They're not getting well oxygenated. And those patients tend to clench their teeth more than others and have pain during the day as well. So we help people with sleep problems, sleep disorder breathing problems, or suspected sleep disorder breathing problems with oral appliance therapies. What we can do for those TMJ sleep problems patients is to relieve them of their pain so they can lead normal lives and forget that they had any joint pain or headaches or sleep disorder breathing problems. We equip them with oral appliances, sometimes orthotic appliances, to reequilibrate and balance the bite and the muscles domestications so that they can have more relaxed jaw joints and less pain. They'll sleep better at night because with the oral appliances, the sleep appliances, we open up their airway and so they can breathe better at night. We also do injections of the head and neck area, starting for the trapezius muscle in the back, to the neck, and to the joints, relieving the patients of their pain immediately with injections. We do also prolotherapy injections to help healing of the ligaments that are loose, that contribute to the jaw joint clicking and popping, and so that patients can actually have less pain and less discomfort. So when we do an assessment, we are first evaluating the patient's history, how their pain started, and how it's progressed through times, what type of medication they're taking, if there is other type of medical conditions that could be contributing to their condition. We assess where they're hurting, what type of pain they have in their head and neck area. And then from there we go on to measure the range of motions, because that's how we measure whether the patient is getting better or not, is to establish a baseline and see what range of motions they have for their jaw, for their head and neck area. We follow through with a joint vibration analysis test. It's a machine that looks like a headphone that measures the vibrations the joint make in motion, and from there we can assess what type of, through those vibrations, what kind of conditions we have, whether it's soft tissue vibrations or bone-on-bone, hard tissue vibrations. We do a muscle palpation exam where we get a baseline of where they're hurting and how badly they're hurting in different places of the muscle domestication of the head and neck area. We also we do a cranial nerve exam, more of screening to make sure they don't have any cranial nerve deficits. We check the motor reflex tests to see if there's any parts of the body that are contributing to postural instability, so we can address that, or if it's coming from the joints, or know where to refer the patient, whether they have back problems coming from the spine or feet problems. Our tests can determine the source of that pain, and so we can treat it and help the patient recover better and faster. We do also a CT scan to evaluate all the hard structures of the head and neck area. We measure the airway volumes. We check the conditions of the temporomandibular joints, and then from there we can have a better view of the neck and whether the cervical vertebrae are affected, if they're contributing to headaches or pain. We do a thorough exam that takes us about 2 hours, and the patient leaves feeling like they have a better understanding of their condition if we can help them, and who else we can send them to help them get better quicker. When we study dentistry, we learn all about teeth and the joint, but we mainly focus on teeth. So they look focusing on the leaves and not seeing the trees or the forest. So being able to do this makes me more, I feel more like more like a dental physician. I focus on figuring out where the source of the pain is coming from, and I address that problem. It has changed the way I practice dentistry because a lot of teeth pain are referred pain from muscles of the head and neck. And in the past, I just did not know that. Now I can stop and tell the patient, well, your pain is not coming from your tooth, it's coming from your muscles, it's coming from your joint, it's coming from your neck, and this is what we can do for you. When we see successes, it just makes my day. I think that's the most rewarding part of what I do as a dentist, to be able to help someone who hasn't been able to be helped by the medical profession, because most of their problems are coming from musculoskeletal pain. They're chronic conditions that keep getting worse with time, and putting a stop to it is just very rewarding. Patients leave feeling better, and I just feel that I have helped them, which is exciting.